Namaskara, I am Dr. Sridhar P.S, radiation oncologist and I lead robotic radiosurgery in Bengaluru, Apollo Cancer Centers, Bengaluru. And also I am a consultant to Apollo Proton Cancer Center, Chennai. To start with, stereotactic body radiotherapy is a high precision radiotherapy where we give a precise target, very high dose of radiation, and the surrounding structures gets very less dose. Because of that, it has a high local control rate to a range of 95 to 98%, and surrounding structures are radiation exposure is very less. That's why the morbidity of the treatment becomes very less. The best way to deliver the SBRT is by Cyberknife. So we have a Cyberknife S7 system. See, we have used it it can be used for the localized tumors, early cancers, and locally advanced, and even to the metastatic disease. Recently, oligometastatic disease has taken a big chunk of the treatment options. One of the best way to treat the oligometastatic disease locally is by SBRT with Cyberknife. So at any given point of time, you can see there is 30 to 40% of the patients will be oligometastatic disease. So when you treat the patients with even up to 3 to 5 areas can be treated with these techniques, in combination with immunotherapy acts very well, and SBRT with the Cyberknife has a great advantage in terms of not only local control, it also acts as abscopal effect, and in combination of immunotherapy, it acts as a cancer vaccine. So these are the main advantages. It's a short duration, only 5 days of treatment. Each day is around like 35 to 45 minutes of treatment, and the patient's tolerability is very good. Yes, the SBRT with especially oligometastatic disease, the metastatic directed therapy, we choose the patient very wisely. It may be the patients may present with oligometastasis. Simple example, see a lung with up to 5 lesions. Either it may be in the brain, or it may be in the lung, or it may be in the liver, are an ideal cases. Or another scenario where see a breast cancer patients have already had a complete treatment, and there is a 1 lesion or up to 5 lesions. There's a metastatic disease which comes up after a certain time. We can go and treat those patients. And in some cases where there is a polymetastatic disease, stage 4 cancers, we have given the chemotherapy and biologicals, reduce the tumor, 1 or 2 tumors which is there persisting. It's called oligopersistent disease. These are the patients actually we can consider for SBRT in ideal situation. Very effective in lung cancer with metastatic disease, breast cancer with metastatic disease, and prostate cancer, colorectal cancers, where all we are looking for good local control and extensibility of life. The cost versus benefit ratio, if you see in treating the oligometastatic disease with Cyberknife, is very cost effective. Number one, the immunotherapy and chemotherapy when you give, we reach to a stage where it is not acting very effectively. Addition of all the SBRT2 in this, because of the good local control with the least side effects, the quality of life is good, and the control rates are good, which is extensive to the survival benefit. So in an example, there's first of all, in terms of cost versus benefit, I wanted to stress upon here, there is no substitute for life and in vis-a-vis with the cost. But definitely when we treat effectively these patients, actually we can see a survival advantage and the cost effectiveness. So it is all about how we are progressing in terms of managing the metastatic disease. Our understanding with the oncology is becoming more. Either it may be in terms of newer molecules with immunotherapy, or understanding the genomic factors where we are looking for a targeted treatments, and addition of SBRT2 into this group of cases actually has a great advantage. And in coming days, we are looking for these patients who are metastatic disease should not be put it as a palliative intent or a palliative care, where we should give a one more chance to make sure that these patients can have a definitive approach and extensibility of life. See, Apollo Cancer Conclave is one of the unique things that actually as an oncologist we need to come together and discuss and debate and make a roadmap for the coming years. Especially in oligometastatic disease, with the molecules available and the approach of our oncologist, I'm sure that in coming years, each oligometastatic disease should see a double digit of survival, which is not far from the newer techniques what we are incorporated. Thank you very much. And as you rightly said, that the experience with the international is almost nearing to 2 decades. So seeing there and continuously doing the camps and helping the doctors locally, I would like to put it in 3 different one. One is a patient-centric, infrastructure, and the doctors. So if you see that the doctors are, we read the same books, we read the updates, the same things. Doctors are brilliant. So that what has made the difference is the infrastructures. It is a very frustrating if a doctor knows everything, but he cannot deliver the things. So that becomes very frustrating. That is what we have suffered when we were 15, 20 years back, when we don't add an infrastructures. Thanks to all our Apollo groups that getting the best of the best instruments and the technology to here, make it usable and make it available to the public. And capacity building is another thing where we talk about. And when we say Proton and the Cyberknife, it is actually national asset. It is not only one thing. So going back to the infrastructures in the international level, when you say that, yes, they're just looking at the things which is going to start right now. It may be a linear accelerator based radiotherapy, if I touch upon radiation as one of the things. So the newer things are coming up very slowly. There are very few centers which have a linear accelerator right now, so which we have it almost 20 years back. So when you come to the patient-centric, patients affordable and the general public. The patients who are affordable are always traveled to different parts of the world, and they have traveled to the other Western countries. Now India is one of the best place because of the 2 reasons. Number one, the doctors are excellent. I remember one of the politicians talking about that. He went to across the West, and they found that they're all Indian doctors who are working. So we have made a difference. That's what we have done. That's why the people say Indian doctors are one of the best. Why don't you come to India? And we are probably better than the Western countries in terms of infrastructure is concerned. So because of this, the international patients has a very unique advantage of coming here, and we are very cordial, and it probably 1/10 of the cost of the West. So it's a win-win situation for them. And for the doctors, does not limit only to this referring patients. So it's a treatment neighborhood is a policy what we'll do it. So in that way, we want to share the knowledge what we are already done in terms of maybe Cyberknife, SBRT or proton therapy. So we want to teach the medical persons. It may be starting from administration, or it may be the nursing which is important, and the doctors. It may be surgical, it may be medical and radiations. They will come here, have a training, go back, and they know what they are talking about. And that is a capacity building is also important in these cases. And also there's the sharing of the knowledge. They are not only just refers, they're the part of the partners in the whole systems, because the patients go back to them and that's completing the loops in oncology is very essential. So that is why this collaboration is very important. So in terms of the patient part of is already told that if you see success stories of ours who across the international landscape, I think we are the forefront in these matters. See, the high precision radiotherapy is the key in terms of radiation is concerned. So SBRT is either the people like it or not is the way forward. It may be a small tumors or it may be a larger tumors. Now I am talking about metastatic disease, stage 4 cancers can also be effectively treated with high precision radiotherapy, where we have a good local control and the least side effects and a short duration, which definitely makes a lot of difference. The SBRT Cyberknife Academy actually mainly aims towards teaching at the training programs, hands-on training, because there may be a technique you may read in the books, or if you go to the international level or there, the biggest advantage of coming to India with us vis-a-vis with doing there, number of cases, what we do is probably one of the highest. the hands-on training, what they're going to get, it is totally different. And each step explanations, not only after complete, not only training them at present, even when they go back, we give a backup to them to make them comfort, starting at each level as in a comprehensive manner, so that they will get the confidence and take it forward. So that is one. So it may be SBRT or proton beam therapy. Proton is a very unique. It cannot be put it in everywhere. And the way forward, what we are looking at, very genuinely, some of these patients, pediatric malignancies, and especially, and also the prostate cancer, which is very high in case of the international or like especially African countries, or it may be hepatocellular cancers. So these are the cancers which can be very effectively treated by proton therapy. And we are also planning to start, we are already started proton beam SBRTs with the short durations, which becomes very effective, where we are talking about no radiation dose after particular one. Treatment related side effects becomes very less. So these things should be utilized, and as an oncologist across the country, across the world, the people should know about this and utilize this opportunity. Thank you. Thanks a lot.